Live from America's heartland, this is the Daily Truth Report with your host, Noah Christopher.
Welcome back to the Daily Truth Report. And I am so excited to bring on a brand new guest today on our show and been looking forward to talking to her for quite a while. Today, Dr. Jennifer VanDeWater joins us. Dr. Jennifer, welcome to the show.
Thank you, Noah. Happy to be here.
Yes, we're so excited to have you here. We're going to talk about a lot of things. We're obviously talking health and wellness with you, but we're going to talk about it from several different angles. And we're going to try and stay up on YouTube, so we might talk a little bit in code, but I think everybody will know what we're talking about. But Dr. VanDeWater is with the Wellness Company, and that's a company that if you've been around our site for a while, we've been talking about them, covering them, telling you what they are doing. But we wanted to have her on and tell her personal story about how she got to this point. Why this mission is so important to her, and then we'll talk about some of the exciting things they're doing over there. So Dr. VanDeWater is a PharmD. She's a registered pharmacist in 3 states: Maine, New York, and Vermont. The Albany College of Pharmacy, so shout out to New York for anybody that's listening. She's known as the People's Pharmacist, and like I said, she's on the Wellness Company, focuses on integrative therapeutics over there, and I love that. I'm a big fan of looking at the whole picture, anything from diet to mental health to lifestyle. And I think we're going to talk about all of that. And I think one of her code phrases that we're going to talk about today is freedom from pharma. And I love that. So we'll explain in a little bit what that means. But Jennifer, let me turn it over to you. And I'd love to hear from graduating from the Albany College of Pharmacy. How do you get from that point to where you're at today?
Yeah, thank you. It's an interesting story for sure. And I really got to say it was divine planning. It had nothing to do with me. I graduated high school and started working at the local, corner store pharmacy as a pharmacy tech, and absolutely enjoyed that kind of work. I enjoyed being out in the community. I enjoyed helping people that were coming in. I just figured, why not go all the way and become a pharmacist and, actually not just settle as being a technician. I thought I could really benefit the community if I just put my nose to the grindstone and studied hard and got out of pharmacy college. And that's exactly what I did. Sadly, though, by the time I graduated, so that was probably 1998. And then by the time I graduated, pharmacy college was around 2006, and I saw the industry drastically change. I believe it was already starting during the late 90s, but once, medications went on ads on TV and in magazines, the whole industry looked at people as needing a pill all the time rather than true health and wellness and what could really be going on. So here I come out of college, excited to be in a pharmacy. Again, I love the retail atmosphere of being in the community. And it was like, you are here to just check prescriptions. You are here to just pass things down the counter to the customer. You are not here to go spend time advising them. You are to sell them. You are to bring them to the aisle, point them to a product, and have them go on their way. That did not resonate with me. So I spent most of my early career after graduating pharmacy college kind of, pharmacy hopping. I was going from one place to the other and hoping that one of these pharmacies would resonate with me and actually want to give care to the people. And I realized early on that it was not there. It was not happening in any of the chain or grocery chain pharmacies. So I decided to look at the independent mom and pops, and they really have that family atmosphere. Their pharmacy has a more cozy feeling. They are not there to push. They really are there to build a relationship. And I really, truly enjoyed it. But what I saw was big pharma was still creeping in, trying to control and manipulate these independent pharmacies through insurance. So what I started witnessing as a pharmacist after working for all the chains and then going to an independent was the reimbursement rates were so low. So at a chain pharmacy, you could submit a prescription in to the insurance and get a huge reimbursement, not lose money. Where at an independent pharmacy, we were losing money. And there were some times we would hit submit on that claim and we would get back a negative $300 amount. Negative $300, we can't pay the insurance company to fill the script for the patient. And so we would have to then transfer that prescription to a pharmacy that would fill it, and it would never be another mom and pop. It would be a big chain. So the insurance company was really holding these independent pharmacies hostage. The other way insurance companies I saw come in and manipulate the system was through medication therapy management, MTMs. And what that meant was the insurance company would send a notice to the pharmacy hey, your patient Jane Doe has type 2 diabetes and is not on a statin. She needs to be on a cholesterol lowering medication to prevent high cholesterol. So we would call the doctor's office. We get this notice. We call the doctor's office and say, hey, we got a request that your patient isn't on this medication. What do you think? And our goal, what we were told to do, is get the doctor to say yes. And if the doctor said yes, that pharmacy got cut a check from the insurance company for filling that request. I did have some doctors who thankfully did their due diligence and actually said, no, my patient doesn't need preventative cholesterol medication. They're doing just fine the way they are with the few medications they're on. But there are so many others that did not, that just completely just said, yeah, go ahead, fill it. I was the opposite kind of pharmacist. I would get these MTMs. I would notify the patient and say, hey, your insurance company is asking for this medication. How do you feel about it? And they always would ask my advice. Now, I love giving out advice, but I want the ultimate choice to be of the people, not for me. So I would let them know what was going on. And most times the patient would say, I don't want another medication. That's some of the things that were happening. So for me, I realized my presence was not going to be as beneficial behind the counter dispensing medications. I had to now reach out and work alongside the doctors. I saw overprescribing. I saw very young people on very toxic medications, and I saw our elderly population really as well on a lot of medications. And their health was declining, not improving. So I thought, if I can leave the retail world and maybe work alongside the provider in the office, maybe I could be a voice for the patient, an advocate on the side, trying to stop that prescription from starting and maybe find a natural or healthier way to help that patient besides just always going to a prescription. Well, that turning point in my career was 2020. And right at that time, when I resigned from my job, starting a new one, that new one ended up being terminated due to everything changing with COVID. So I was on the sidelines watching everything happen. And with the way I like to describe it, I look back in my career and I see moments of awakening, and I call those God moments. There were moments that I was seeing some things happening that led me to knowing I had to leave retail practice and actually go and try to help the patient from alongside the provider. I had no idea, though, at the time, that being so obedient, I guess, in what I was being asked to do without even realizing it was going to take me out of this idea of locally working to actually working nationally alongside doctors to really bring health and wellness to the people.
Wow, that's an amazing story. And so much, I love the way that starts to end, but so much in that story is so troubling and we know it all along. I think we all knew it, but to listen to you tell it, I had no idea about how corrupt the system is. And of course, it's the big insurance, big business, big pharma pushing out the little people, because the little people can still make some decisions that might be best for you. And that's really troubling to hear that. But okay, so you get to the point where you feel like you can actually make some positive changes in the world, and then that is 2020, and we all know what happened in 2020. We have the world changes, C19. So maybe, like you said, some amazing God timing here for you to be just in the place that you needed to be.
Yeah, I totally agree. I believe it was definitely. I look back, and you don't know it in the moment. In the moment, it's like you're panicking. I'm like, oh my goodness, I just left this job, but I don't want to go back because I see stuff happening, and I'm concerned. I'm questioning what's happening. So I just stayed on the sidelines, and I'm really glad that I guess the best way to say it, stayed obedient and just patiently waited for the right opportunity, and knowing what I was being asked and called to do. I had no idea. I had no idea at the time, but it was definitely scary. I will share, I had a moment. I remember sitting on my couch and just asking God for I needed guidance. I said, what is going on? I'm so afraid right now. I'm walking away from my career. This is all I've ever known. 18 years old. All I've known was pharmacy. All I knew was to work retail pharmacy. All I knew was to help people. So what do I do now? I don't want to go back to college. I don't know what to do. And I felt this overwhelming, paralyzing fear. And in that moment, I actually heard the voice of God say, you should not fear the devil, but he should fear you. And in that moment, I just knew that I had the power within me to just be motivated to say, okay, you've given me a clue, you've given me something to hang on to, some hope. I'm going to now take that and see where that leads me. And it really did lead me here to the wellness company to be part of an amazing team, to build out this pharmacy department within the wellness company where it's not about big pharma, it's really about the people.
Yeah, and I love it because I've always said that, especially after what we saw happen in 2020 and beyond, and really 2016, and the way the country became so polarized, and suddenly you couldn't even admit if you had certain beliefs in this country. Right. But I've always said that good people need to speak up, and that means the people in the community, the doctors, lawyers, teachers, pharmacists, everybody. And that's what you're doing at the wellness company, and I love it. And there's been so many in the medical field that have really, I guess, become corrupted, but I love seeing good people band together and speak up and say this isn't right and we have a better solution for you. So I love what you're doing, and you've got an amazing team over there. It's probably too many people to name, but another guy that we cover quite often, Dr. Peter McCullough, I believe is on your board. Can you speak to some of the people within your company?
Sure, happy to. Yes, Dr. Peter McCullough. We've got Dr. Heather Gessling, Dr. Richard Amerling. We have Dr. Harvey Reish and Dr. Robert Seek. So we got two PharmDs that have the Integrative Therapeutic Board, myself and Dr. Robert Seek. And then we have the Chief Medical Board as well. So that's our Chief Medical team right there.
Yeah, incredible. And we've been watching what your company's doing, and we love to help you get the word out too. So tell me about Freedom from Pharma. I mean, we can kind of get where this is going, but I love that name, and I love the idea that you don't have to take a pill for everything. And we've all had people in our lives, usually, older people in our lives, and they're on so many pills, and one doctor prescribes this pill and another doctor prescribes, and they never talk to each other. And you might have, right. And this probably better than anybody, but it's getting to be a real problem. So I love the phrase freedom from pharma. What does that mean, and how do you roll that out?
Sure. Yeah, I love it because I feel that I am free from pharma. Like I think when I introduced myself before we even began, I'm like the anti-pharma pharmacist. Like I actually feel weird to go out now and tell people I'm a pharmacist because it kind of makes me cringe. I'm like, well, I'm not that kind of pharmacist. So I love that we can have a team of wellness pharmacists, is what we call ourselves, who actually understand that it's not about prescription. A prescription should not be first-line therapy. It should be last resort. We should be looking at the body as a whole. We should be looking at lifestyle modifications. We should be looking at nutrition. We should be looking at detoxing and cleansing. There's so many things that are necessary for us to be in good health before we just go to the prescription route. And so through Freedom from Pharma, we have a team of wellness pharmacists who meet with patients. They spend about an hour on the first appointment really combing through their history, through their life choices, understanding some of the conditions that they're questioning or concerned about, looking at their medication list, looking at their supplement and over-the-counter medication list, and kind of coming up with a plan. And so through that, it's a journey too. I want to really be clear that starting Freedom from Pharma is not 3 appointments and you're free. A lot of times when you're taking 10 medications, it took, quite a few years to get to beyond 10. It's going to take some time to actually work through which ones to start deprescribing, which ones are unnecessary, which ones maybe you cannot deprescribe, but what can we do to maybe lower the dose of those medications so you're not on such a high dose? So there's definitely a lot going on behind the scenes, I guess, with the pharmacist and the provider. And so the pharmacist does all the evaluation, does all the, triaging of the patient, understanding things, getting a baseline, giving natural recommendations to start. So a lot of times too, when you're taking prescribed meds for a very long time, the body gets out of balance. And so before you can even start tapering and coming off of some medications, you kind of have to build back some health, restore some health. So I think it's really important for people to realize that the first few consults are going to be just working through some of that and making sure that you're ready to then meet with the provider and start that deprescribing plan. And the pharmacist and the provider are always in contact, talking things out, working things through. And we have had quite a few people actually come into Freedom from Pharma and actually be deprescribed off of some unnecessary medications. And we've even had some that have come through and have graduated and feel that they are happy to be free from being on pharmaceuticals. So it's an amazing program. We actually have it outlined on our webpage. If you click on the Freedom from Pharma under virtual care, you can read all about what we're doing, meet the team. We have amazing pharmacists, Sue, Melissa, and Mark. Mark is actually also our naturopath as well. He's new to the team, so he's not seeing patients just yet. We're getting him trained on the system and everything, but he will be up and running to see patients at some point, and it's going to be amazing to see more and more patients come through. And I chuckle. I remember the Dave Ramsey when he said debt-free Fridays. I want to have free from pharma Fridays, where we can have a round of people like throwing their prescription bottles, into the trash and being so proud that they're no longer dependent on a pharmaceutical and they can actually, be free from pharma.
I love that. That's a great idea, and I hope you follow through on that. And I'd love to post that video.
Oh yeah, we got to get everybody. That's the problem. I got to have people send in some selfie videos.
Yes, that's fantastic. Well, you mentioned your website, and for anybody, we'll put the link below this video. But if you want to go check out this website, it's twc.health, and that stands for the Wellness Company. So twc.health, if you want to check that out, or just look below wherever you're watching this video on YouTube or Rumble. We'll have the link down there below. I want to talk about, you have some amazing products that are helping a lot of people. And I've heard a lot of comments from people that we've talked about them before, and I've heard some great feedback. I want to talk about those. You have one that deals with the spike protein. We've all heard about the spike protein. It's called Spike Support. I want to talk about that in just a moment. You've got an immune boost product. And then you've got one that I think a lot of people might really be interested in, which is allergy free. So if anybody's suffering from allergies, you've got something really interesting there. But before we get to that, I just want to ask you, listening to your story, and I know there are a lot of other good voices in the medical community that have spoken up, and they faced some extreme pushback. So I wonder if you can share your story about you or the other doctors in the wellness company. What type of pushback from medical boards or the medical professional community have you experienced as you're trying to change the world and do this? I assume that you must have faced some difficult challenges along the way. What's your experience been like?
Yeah, mostly I've encountered some former colleagues that just kind of are a bit disgusted that they feel like I'm going against our industry, who we are. I have that has been the hardest for me, losing some former friends that just they see that I'm speaking out and they think I'm, not legit. And it's true. What I witnessed in practice, I saw people on the most medications in the least health, and the people on the least medications in the most health. So you can't help it but know what you see. But sadly, a lot of my colleagues were completely under the illusion of the pharmacy college, what you're taught that quality of life comes from prescribed medications, and they don't understand and they don't see. They blame it on something else. They're not blaming it on the prescription. They're blaming it on lifestyle choices, which, yes, that plays a role. But if you help the patient with their lifestyle choice, they might not need the medication. So there's a lot of things at play. So for me, it's mostly been from colleagues. And actually, the last pharmacy I worked at, I was actually really disappointed that they kept some certain prescribed medications that normally would be used for the C19. They kept them locked up during the whole time. Mm-hmm. And I was surprised to hear that. I thought these people that I worked with were a little more awake. The technicians, yes, the pharmacy technicians, very much so, very aware. But the pharmacists were logging everything out as if you were dispensing like a fentanyl patch or morphine tablets. I was surprised to hear that was taking place. So for me, because I was out of the workforce when everything kind of happened, and now I'm just kind of going forward with the wellness company, I was not ever working somewhere where I had to speak out. But those that know I'm speaking out, some of them have been, expressed their disappointment. And that's okay. That's okay. I'm not going to stop because of that.
Do you have any idea? Do you think that those people that you did face that pushback from, or that just refused to open up their eyes to any of this, do you believe most of them are just true believers and they just really think they're doing the right thing, or do you think they're afraid to bite the hand that feeds them? Which one do you think it is more often?
From the ones that I know, is they truly believe that what they're doing is good. They believe what they've been told. They've been so, they're just so good at being indoctrinated. They just are completely unaware. They really believe that everything we are taught in pharmacy college, everything about medicine is on the up and up. I mean, they believe all of it. I don't think they're thinking about harming people. They actually think I'm harming people because I want them to be off of prescribed medications and find a better natural way to make it, and live healthier, to restore their health. And so I think that's what I'm seeing. I do know there probably are people, I just have not encountered them personally, who are afraid. Actually, I was on a show one time, right in the beginning of all of this, and I asked the radio host, I said, do you ever talk to any other pharmacists? Like, it can't just be me. Like, I said, there's got to be more out there. This was when I was like very new and speaking out. And he says, you know what, Jen, I do. He said, I do speak to them, but you know what I hear the most? I'm like, what? He goes, they're afraid. They're afraid to speak out. And I said, well, I'm not afraid, because when it's the truth, I'm not afraid of sharing the truth. And I want people to know, I want people to be aware of what's taking place. I want them to know you need to stop supporting those chain pharmacies that are not there to benefit you, and support those mom and pops that are aligned with your values, because there could come a day we're going to need another medication, and they're the only ones that are going to say yes to making sure you have it. And so it's very easy to say, well, I'm paying, a $5 copay at, this chain drugstore. And if I go to this independent mom and pop, I'm paying 15 or 20, or you're paying a cash price because they don't take insurance. But what you're supporting for the future is, really immeasurable. No dollar amount can be put on that.
You mentioned, and I know you were dancing around it, and I appreciate that, so we can try and get this message out to more people. And I'll try and do the same thing. But you mentioned a couple medications or products that were talked about a lot, even by we'll call them T45. We know who we're talking about. And I think they rhyme with cybermectin and epoxychloroquine. But I have my opinions about those, but I'm not a medical professional or a pharmacist. Have those truly been traditionally known as being powerful drugs to treat this type of stuff? And did you see the medical coverage change on those in these past 3 years? Can you speak to those a little bit?
Yeah, exactly. Yes, these have been used for the exact reason they're being used for now. There have been studies done back in the late, early 2000s, almost 2010, like in that decade, showing that, yes, they are safe and effective. And they are safe and effective. And I will say this too, it is not the role of the pharmacist to determine efficacy. Our job is to make sure that when we receive that prescription, it is written and it is dosed appropriately for that patient. And then when there's a question, we call the provider. We ask the question. We do not just blatantly say, no, we're not filling this. I mean, that is just nothing that's ever heard of. And we have never said we don't fill it because it's off-label use. About 80% of what pharmacists dispense in a pharmacy on a daily basis is for off-label use. I mean, so many medications go through all the studying and all the testing under one reason for use. And then when it comes out through the study and they found other reasons that are not put on the label, and the providers know about it and they use it all the time. We've seen antidepressants used to help in sleep. We've seen sleep to help with anxiety, and using it all the time. We've seen antidepressants to help for stop smoking. There's a lot of things that have been used, and it's, being off-label use. I don't know why that became a big thing. And pharmacists just out there, I believe it personally was a little bit of a power trip, a power struggle. They thought they could have the authority, but what they were really doing was not going against the doctor. They were actually going against the patient. They were actually harming the patient at that point. But yeah, those medications, safe and effective, really beneficial. I do recommend that people always have some on hand in case, you do get sick. Early treatment is key. We don't want someone to be without. That's really important as well.
How would you go about getting some of those?
Well, you can come to the wellness company. These providers were the ones that wrote the prescriptions for those medications during the height of everything. So these are the providers that understand that. No, we are partnered. Actually, our other pharmacist on the Integrative Therapeutics Board, Dr. Robert Seek, he is our preferred pharmacy, and he compounds this for people. So you're not taking, 10 pills to get your dose, because nobody likes to be swallowing a lot of pills when you're not feeling well. So he compounds it for us, and he ships it to the patient. So he helps us with that. And we have a way of getting it for people. I do want to mention, I know I talked freedom from pharma. Now I'm talking about patients getting access to care. It's really important. We have the new membership, One Wellness. One Wellness is an all-inclusive membership, unlimited care, free monthly supplements, free access to freedom from pharma, and you can use your access to a provider not just for long-term treatment. Say you are suffering from, a long respiratory illness, and you want to see a provider to make sure you're doing everything necessary to fully recover. Yes, you can, but even if you want to come in for an acute care visit under One Wellness, it's completely covered. So One Wellness is being set up more like direct primary care, so that patients can come in and have unlimited access and be able to have the support needed so they could use Freedom from Pharma, get free supplements. It's a pretty good deal.
Excellent. And again, if you go to twc.health, we're going to put a link below this video where you can check that out. Our guest today is Dr. Jennifer VanDeWater, and this has been a fascinating conversation. You started to talk about getting the care, and you've got, so if anything we've been talking about today, if you would like to get in touch with someone, that's their One Wellness program. They've got other programs, but you can actually speak to one of these professionals. You can get care. You can do telehealth. You can do all sorts of other things. And you just go to that website, twc.health, and you can see a lot of different options. You've also got, I'm on your site right now, just looking at it. You've got a lot of great products, a lot of stuff that we've talked about. And again, I always make clear, I'm not a pharmacist. I'm not a doctor. I'm a reporter. That's it. But you've got a lot of stuff. You've got liposomal, vitamin C. You've got alpha lipoic acid, vitamin B complex, a lot of stuff that we have told people. You've got the Z-Stack formula. We're all familiar with that. That's excellent. Got a lot of stuff here that we have told people, just vitamin D, how important vitamin D3 is to your health and wellness and hormones. And so you got a lot of great products on here, but I want to talk about a couple of them. One is the you call it the spike support, and the other one is something I'd never heard of before. You told me about it today, but allergy free. And I want to hear about that for anybody suffering allergies. We're recording this in April right now, and we are in full bloom allergy season. I'm not an allergy person, but I know a lot of people that are. So that's all the pollens and everything else coming out. So maybe start with the spike support. Tell us about that. I know I see so many people grabbing some of that from every time that we talk about it, but they've never gotten to hear about it from you. So please explain what that does.
Well, I'm happy to, because I am actually someone who encounters the shedding, and I'm someone who suffered with long COVID for a while. So if I would have had this then, boy, oh boy, it would have saved me a lot of trouble. So this product has amazing, amazing natural ingredients that really help with anyone who has the shot and is concerned about, the outcome of what things they're seeing. They have regret. I want you to know there's no fear. We have this product that will help clear the spikes out. We have people who are concerned about being around those with possible shedding. Again, this is going to help with that. And like for me, I mean, I'm obviously working from home, but when I do have to go out, I use this as needed. I take it a few days before, during travel, or during whatever event I have to go to, and then a few days after I return home or the next day. And I just use that as needed. And I have been fine since I started using it. So an amazing, amazing product. And I'm saying it firsthand because I use it myself, so I just love it. It has ingredients that, again, are all natural. So the dandelion root extract and the black cumin seed oil, those were chosen to inhibit and neutralize the spike proteins. Then we have Irish sea moss. Irish sea moss was chosen because it helps to rebuild any of the damage to your tissues and muscles, endothelial lining that was caused by the spike proteins. The green tea extract is a powerful antioxidant, so it kind of goes around the body, cleaning up a lot of the junk that can be caused and the damage that's caused from the spike proteins to other cells. So it cleans those bad ones out for you that are roaming around that you don't want there. Selenium is a natural anti-inflammatory, other amazing benefits, but that's why it was chosen for the spike support. And then the one ingredient that everybody, I swear this should just have its own, platform,
Yes.
is the nattokinase. Now, when we chose the nattokinase, we chose it because it was a known natural anti-fibrinolytic. So it broke up clots, the fibrin clots. And so that was the reason. So then 6 months later, after we had formulated this, a study came out of Japan showing in vitro that the nattokinase actually degrades and decomposes the spike proteins. So an added benefit that we did not know when we put this together. So we're very excited that it is in this formula and it's available for people. And I do recommend, if you did take the shot and you're really concerned, use this indefinitely. We know that with the shot, the spike proteins were encapsulated with the lipid nanoparticles to get into every cell and to start manufacturing these spikes. And so we don't want you to have an overload to start and stop. It's best to just use this as part of your daily regimen to stay safe and protected. And again, if you are just someone concerned about the shedding and you're not out and about in it all the time, use it as needed. And I promise you'll be happy that you did. It's been amazing. I love using it. It's been great.
Okay, so it is safe. You put it in your daily routine and safe to take on a regular basis and kind of maintain those levels.
Correct. The only, I guess, contraindications to mention, not for children like under 17, but we are coming out with a kids formula. So we will have that available hopefully sooner than later. It takes a lot to put these together, especially for children, but we will have a children's formula. We also do not recommend for anyone on pharmaceutical blood thinners. We recommend that you speak to your provider that prescribed that first to see if it's something that they recommend you take. And then we also highly caution in women that are pregnant and nursing, moms as well.
Excellent. Well, I'm on your website now, just having fun clicking around, but and I want to talk about the allergy product, but this I found one that before we get to that, I guess is the opposite of that. What is the natural bee pollen? What does that do?
Yeah, natural bee pollen is actually, it's so amazing. You take 1 teaspoon a day, you could put it on your breakfast, put it on your yogurt, put it in a smoothie, and bee pollen naturally builds your body where it's lacking. So it's, I kind of call it's God's multivitamin, because it's not a vitamin. It's actually like a food aid, I don't know, supplement. I don't even like using those words, but it's like part of your diet, something you should consume. And so you use it daily and it gives you improved mood. It balances you out. If someone did lose their taste and smell, it helps to restore that. It's really been helpful for people with memory. I mean, it's just all around really, really good. Yeah, to have bee pollen. And this is sourced, it's all natural. You have to be really careful with bee pollen. You do not want to purchase from someone where you don't know if they spray their flowers or anything that they're getting the pollen off of, because then that goes into the pollen and then you're getting that toxin into your body. So you want to make sure it's definitely pure, and this is sourced from a really good source. So yeah, I started using bee pollen probably about a year ago or more, when I found out about it from one of my friends who's a naturopath, and when she told me, I was just amazed. And so I started using it, and I don't even use a multivitamin because I use the bee pollen as like my natural multivitamin, but I do take D, especially living in the Northeast and not getting the sun in the winter time. So I still take my D to keep my D level up, but I love doing the bee pollen. I can definitely tell it. If a couple days go and I miss taking it, I definitely can notice.
Wow. Okay. Well, this is going to be a first. I have never actually ordered a product during an interview, but I have just added that to my cart, and I'm going to get some bee pollen.
That's cool. That's great.
So,
Yeah.
all right. Well, before we wrap up, I know there's a lot of people that suffer from allergies. So we'll leave the bee pollen and we'll talk about allergy free. And this is not, we're not talking shots. I know a lot of times allergies are treated with shots, but if you don't want to get shots, you have a really innovative product here. Tell me about your allergy products.
Yeah, it's actually really cool. Now, I know a lot of other countries use it, no problem. Oh, sorry, my little guy's coming in. I should have closed the door. But yeah, I know a lot of other countries have, this available, and it's been around since the 80s. So it's not like it's even something new. It's actually kind of, how it is. They just don't want you to really get better. So it's kind of one of those things that's kind of been like on the DL for a while. Well, we came across it, thankfully, through our Dr. Robert Seek, who's on our integrative therapeutics board. He said, "Hey guys, I know about this. Let's figure this out." And so we did. And he actually is the pharmacy that supplies those sublingual drops. And so it is a sublingual immunotherapy. Sublingual is a drop that goes under your tongue. You use the drops for 1 year, and they are microdosed of the antigens. And on the website, you will see all the antigens that are in these drops. So it helps to desensitize your body from reacting to when you come in contact with that allergen. And the amazing thing about this, so yes, it's no shot. You don't have to get pricked with a needle. You don't have to keep going back. You do these drops for a year, and you very much can be remaining allergy free. And then also, you're not having to go back and redo things. As a lot of the people that we have in studies we've read, they were able to do this for the year and be allergy free, and then even come off of medications. So when the body is encountering an allergen, you have a histamine response. That's an inflammatory reaction. And so when you decrease allergies, you're decreasing other areas in your body of inflammation, because sometimes allergies don't always present themselves as itchy eyes, runny nose, all that, or even a rash. Sometimes allergies are presenting themselves as migraines, as asthma. And so we have one patient study that I read, and I was amazed at how he was suffering from migraines. He had severe asthma, was on tons of medication. After he did the year, completed the therapy, he actually had reduced migraines, better breathing, and was able to reduce a lot of his medications. So I was just, that to me was enough right there. I said, this is great, because my freedom from pharma, that's what I was thinking. I'm like, if we can get people then to, not have to worry about allergies, they can actually start to come off of some medications as well and live healthier. We actually had another study that was a woman. She was very allergic to cats, always wanted cats, did these shots, has now 5 cats, and she did the shots 10 years ago. So it hasn't had to redo them. So really, it's amazing. And the other thing that a lot of people that go to an allergist have to get those allergy tests. And, they do it to your back, and you get swelling and the bumps, and they're trying to see what you're allergic to so they can put together your shot.
Mm-hmm.
Well, with this, you don't have to do the test, because everything is included in that sublingual drop. So you don't have to worry about what you're allergic to, because you're going to get everything that your body could use to work and build up. And it's kind of like homeopathy, microdosed. These drops are like microdose therapies that help your body like work out. And by the time you get to the 12th month, you are no longer, having to worry about those allergy symptoms.
Wow, that is fantastic. So I just know a lot of people listening to this are going to really benefit from that. And like I said, I'm not an allergy person, but so many people are, and I know it really is a hindrance to their life. So go to twc.health, or just actually click my link below this video. It'll take you right to it. You're going to go to the website and then go up to, there's a shop button, and you can go to Feel Better, I think is where you can find that on there. You click around, and I'm looking at it right now. You have 5 different peer review studies posted on that page. So if you're interested in more of the details and the medical studies behind it, they're all posted there. And probably you have 5 there, either maybe a lot more. And like you said, this has been around for a while.
Yeah, there's a lot more, but we put up 5, just, we don't want to, it can get boring, it's all the same thing, but
Yes.
yeah, there's a lot out there. Definitely can do your research. It's just amazing. And again, a patient cured is a patient lost for big pharma. And so our goal is not profit. Our goal is care. We want to bring care to the people. We want to give them options. We want the patient to make the health choice. It's your health, it's your choice. It should not come down to any entity or any doctor, pharmacist, anybody to tell anyone what they should do. And even for myself, I come and give you a recommendation, but I ultimately want the choice to be the patient's. I don't ever want me to be the one telling anybody what they should or should not do. I am happy to help and give advice, but I really want people to be empowered and owning their own health and living in health sovereignty. That's what my goal is. I hope to see that really come to pass in the next few years.
Our guest today has been Dr. Jennifer VanDeWater. Absolutely fascinating conversation. And there have been so many good phrases here. I've been jotting them down as we go. A patient cured is a patient lost. I love that. I love the phrase deprescribed. I think that's wonderful. You never even heard about that before. So I love what you're doing. I love freedom from pharma coming from a pharmacist. So really just a pleasure to get to speak with you. I'd love to have you back on. I'd love to also hear from some people. I know this interview is going to change some lives, whether it's through the allergy, freedom from allergies, or whether it's from someone who took the jab and maybe did it under duress of losing their job, or did it because they were pressured, or the worst is the people that were bribed with the Krispy Kreme donuts. I don't have a lot of sympathy for that one, but
yeah, there was the French fries. Don't worry, we saw the former mayor of New York City with French fries and hamburger, and I was just like, oh my goodness,
not good.
No, not good.
But there are a lot of people that took it and never even wanted to take it, but felt they had no other choice. And so I love that you're giving them something here to reclaim their health and to fight back. So I want to thank you for your time, and thank you for what you and everybody at the Wellness Company is doing. We'll have the link down below if you want to find out about joining, if you want to get in touch with one of these doctors or pharmacists, get a customized plan. You can talk directly with them. They have all of those options. Or if you'd like to just grab some of the things we talked about, if you're like me, I'm ordering the bee pollen as soon as we get off this interview, and I'm going to try bee pollen for the first time. But I'd love to hear if you're watching this interview will be up for forever after we post it. So drop a comment down below. I'd love to hear if you take these products, if they've helped you, if they've made a difference to you. Send me an email. My email address will be below this video as well. Get in touch with me. I'd love to hear your story. And we're going to, Dr. Jennifer, if you'd be willing, we'll have you back on again in the future.
I'd be happy to come back for sure. Thank you. My pleasure.
Wonderful. Well, thank you so much. Keep changing the world. We love it.
Thank you. God bless.
Thank you.